And
Go ahead, Martha.
I'm gonna first of all welcome Mabir, the CEO of Center for Migrant and Refugee Health, to be able to introduce some of the people that are in this panel. Mabir, the line is for you now. You're welcome.
Okay, thank you very much, Martha. Is my line clear? All right, yeah. Thank you very much, Martha, and thanks everyone who have attended today. First of all, I would like to acknowledge the traditional custodian of the land on which we operate. We respect their elders, past, present, future, and we are committed to recognize their culture and norms. We also embrace diversity and inclusivity in our workplace. Of course, it's a great day today, as Martha said, that this seminar will showcase the importance of what it is that we need to convey to our community, and that itself is COVID-19 education. And most of us are aware that COVID-19 is still around and will live with us, and not all communities are aware of this. And it's our commitment to continue doing this, making sure that we educate our community so that they understand some public health measures that will actually try to help them in making sure that they manage COVID-19 as they live with it. With the guests that have come today, you are most than welcome. We have John, the CAL manager from Department of Health, with his team, Jomi, and I think Ruo also gave an apology. I also acknowledge the presence of local public health units, staff that have come here. Catherine from Southeast Public Health Unit, doing some engagement, a lot of engagement in Southeast, and I do receive a lot of messages from her. And that's quite very important because, as the trend changes, we get a lot of messages, we get a lot of information that are quite important for the community. I also acknowledge the presence of Peter from Western Public Health Unit. Peter, you're welcome on board. And members from Department of Justice and Community Safety. So we also invited them because they're also doing great work with young people, and their work is also quite important this time, so that young people are aware of what is going on in terms of COVID-19 education. Also welcome community members that have joined here today, and please feel at home. It's just interactive session that if you have any question, should anything that you don't understand comes up, then you can just ask the question and it will be clarified for you. So otherwise, welcome, and I will hand it over back to you, Martha. Thank you.
Yes, yes, we have. Thank you so much, Mabir. That was amazing. We have a lot of people here who would like to specify their roles and their contribution to the community, what they work, what they do, and some of us here we don't actually. A lot of us do not know each other's and what roles we do within the community. So that part was supposed to be also given back.
I'm sorry, let me just interject. I forgot, our guest today actually is Dr. Lake. Dr. Lake, welcome, please. It's a great commitment. I know you're quite busy, and I really appreciate your presence, please. Thank you very much. You're more than welcome, and my staff too. Thanks. Bye.
Yes. The floor is for Peter to do a bit of introduction of of the guests that are speaking tonight?
I think what we need to do is to go straight to presentation. We need to invite Dr. Lake to go straight to presentation. Thanks.
You're welcome, Dr. Lake.
All right. Yeah, thank you. Thank you very much, Martha and Mabur, for your time and all the guests that are here today. I'm very privileged and very happy to be involved in this. So thank you guys for the invitation. I've got a very, very short PowerPoint presentation to just give an outline of what it is we came here to speak about. And, you guys may pardon my background here. I had a thought of having maybe, a beach and a boat in the back, but Peter already beat me to it. So I can't do that anymore. So I'm just going to share my screen. And then you guys just let me know if you're able to see that. Excellent. Yeah, and let's see if we can make this a little bit bigger. Where's the slideshow? I just want to start the slideshow. There we go. All right. Excellent. Can you guys see that?
Yes.
Yeah, so this presentation will basically cover general COVID-19 health. It's a bit of an update, really, given that, we've been trying to now live into this post-pandemic period. And just to introduce myself, my name is Lek Makwei. For those that don't know me, I'm based here in South Australia, actually, in Adelaide. And I'm currently working as a medical doctor at Flinders Medical Center. And another disclaimer I should put out there that I'm not specializing in infectious diseases or in COVID in particular, but I am doing physician training, and part of that is infectious diseases. So the outline is going to cover basically how to live with COVID and the impacts that it's had, a little bit about COVID vaccinations, and some of the oral treatments that are available for if you get infected with COVID. So I sort of try to do this in a sort of an individual based checklist as well as a community-based checklist in terms of how to be ready for coronavirus and COVID-19. So it essentially is to prepare ourselves the best. And that's how we do with most things, so being up to date with our vaccinations is very important. Ensuring that there's general medications to be able to provide supportive treatments while you're at home, because you can get quite feverish with COVID, and having the paracetamols and cough syrups is important. Pain relief as well, because sometimes you get a lot of headache, and having the personal protective equipments at home, things that disinfectants, hand sanitizers, and the general masks as well. And if we look at it from a community perspective, I think to me it's more about ensuring that we're maintaining our mental health. And I think the topic of mental health actually came to light quite a bit with the isolation that a lot of us have had during this period. So planning ahead in terms of food and essentials while you're isolating, being able to familiarize yourself with the online ordering, checking in on families and neighbors, and ensuring that you have all the numbers of service providers handy around you. This part is very similar to the last part, but it's more about if you actually get, if you become positive or you get infected with coronavirus, sort of what are the things that you should start to think about. And obviously local guidelines will differ from different places. So for example, If you test positive, it's very recommended that you isolate. I think in Victoria, it's at least 5 days. Generally, you sort of get 2 days with coronavirus before the symptoms really show itself, and when you get tested. So that's sort of the infectious period is 2 days before you actually get the symptoms. If you take a rat test and it's positive, you should notify the health authorities as much as you can. Keep them up with your fluids, with your rest, and making sure that you are physically capable of being able to deal with the coronavirus. And in making sure for the elderly patients or elders in the community, if you are on regular medications, to make sure that you continue those medications, unless obviously your local doctor advises you not to. The other thing from looking at it again from a community perspective is to notifying your household members as well as where you work and your school about when you test positive, reaching out to family members and making sure that you're not dealing with this by yourself and you're not sort of isolating yourself, because that then can turn into something else. And there's always helplines available if you feel like you are isolated or feeling a bit lonely. So I think it's important to be aware of those, things like your local doctor is very important. There's a national coronavirus helpline as well as Beyond Blue when it comes to mental health side of things. So now to sort of moving on to the vaccination schedules and what would be considered as up to date, because sometimes it can be a bit confusing for some people. So the ATAGI, which is the Australian Technical Advisory Group on Immunisation, basically put out this as a vaccination schedule for coronavirus to ensure that this what would be recommended for you to be up to date. So you can see here with the ages that if you are there's the general population and then there's the immunocompromised population. And most people that are immunocompromised are aware of that. So those people that are on, very medications for cancers, for example, on chemotherapy or things of those nature. And you can see here from the different age groups. So once you get to, above 16 years and above, it's essentially having 2 doses and a booster dose at some point, generally recommended about 3 months after the last primary dose. Okay, so that sort of covers the vaccine side of things. The last part, I think, which is probably a little bit more, I thought that I would go into a little bit more, is the oral treatments for coronavirus. And this is the basically all the available treatment for coronavirus. Some of these are sort of still getting tested to some degree, but a lot of these are available out there. The ones that are put in boxes are the ones that are oral options. The others are all injections and may not necessarily be something that would be relevant, I think, for this talk. Okay, so the oral options are the corticosteroids. So the steroids are normally for those that have have either a lung condition, for example, asthma or COPD, or like emphysema, and those are people that have moderate coronavirus, so they need oxygen. So they're normally going to be in the hospital. So we're not going to worry about those people. So the 2 that are really available are molnupiravir up here and Paxlovid. So molnupiravir actually is the oral treatment has been given quite a bit up to recently, because there's a large panoramic study that came out in October, which essentially showed that it did not reduce hospitalization or death as much as we thought it would. So it sort of come down a little bit on the list of oral treatments for coronavirus. And essentially, we're now left with Paxlovid as the main oral treatment for coronavirus. So who gets to get the Paxlovid would be the next thing to focus on. If we've cut it down from those three to just basically one, first thing is you got to have mild symptoms, mild coronavirus. So basically people that are not requiring oxygen is the main thing to differentiate between mild and moderate and severe and critical. So even if you have coughs and fevers and things like that, that's mild coronavirus. Once you have mild coronavirus, you have to be at risk of progressing to severe disease. And these are the people that are at risk of progressing to severe disease. So anyone that's of an older age, got diabetes, obesity, renal failure, or you have an immunocompromised condition. And once you sort of qualify in those areas, it has to be within 5 days of symptoms. So if it's like 7 days down the track, then we don't have the evidence to back up whether the Paxlovid would be useful at all. So that's essentially it. You have to have mild disease, you have to have it be at risk of progressing to severe disease or moderate to severe disease, and you have to be within 5 days of having symptoms. And it's normally one tablet twice a day for 5 days. You basically summarize that once again. So only people most likely need hospital care to get coronavirus would get Paxlovid. So these are people at age above 70. If you're over 50 with certain health conditions that I've listed before, like kidney problem, lung problems, heart problems, or you have a weakened immune system. And that's all for my talk. This is where I got all of those information. I think a lot of people can easily access that information, except for the medication part of it. I think you have to have specific access to get to the National Clinical Evidence Task Board and have all those treatments. So thank you guys for your time.
Well, thank you very much, Dr. Legg. That's a great presentation. I believe now we are open to Q&A. I just want to first of all ask you about the medicine accessibility to the community. What I've realized in my interaction that I've done last week with some community members, it looked as if, not majority of them were aware of the drug that are present.
Yeah.
It looked as if, you need to go to GP, but, many of the community members are quite reluctant, in managing COVID-19 or already being mindful about COVID-19 impact. So what are the best way that we could make sure that communities are aware of such drugs? And try to give them a better education, especially what we've talked about. What strategy can we use?
Yeah, no, thanks for that question. I mean, I think having seminars like this is part of it, isn't it? The first thing is that basically creating awareness that there are medication available. That's the first thing. So if having educational sessions in which to notify the community that there are medications available, especially for our elders. And I think it's upon us, the younger people within the community to notify our elders about those things, because obviously a lot of that, they might not be accessing information as easily as we do. So that would be the first thing that I would say. And in how you target different groups within our community would be the other thing. The best thing is to go to where people are, essentially. If we're able to expand this forum to areas or to times in which the community have access to it, would be very helpful. I'm sure, you know, myself and any other healthcare within our community would be willing to come in and do sort of an in-person talk about some of the medication in particular, because you're right, these are sort of new information compared to before, where it's all about focusing on the vaccinations.
Another part, as to follow up to my question, is about the efficiency and efficacy of the drugs that are on trials. There are a lot of debates online, social media, that actually give a lot of misinformation whether or not those drugs that are effective. And given the health literacy of our community, they kind of taking a negativity more than looking at the positive aspect of the information that are online or maybe being given by health professionals. So in a way, how do we debunk such information so that community understand such trials are important? Looking at the statistics data that could be important, that could demonstrate that these drugs are important to our community, and give, but outline based on the statistics.
Yeah, no, it's a great question, Mabur. And I think, we also had similar issues with the vaccinations, where there was a bit of mistrust about, the efficacy of it, and not even that, and also, some of the side effects that were put out there, like the infertility, which were not based on any evidence. So, like the way I go about it is normally try, as I said, always try to reach people where they're at. Our community are they're very fond of antimicrobials, not antibiotics, right? They trust antibiotics very well. If someone gets unwell, he's like, I'm going to go to the doctor so I can get antibiotics. It doesn't matter what it is, how sick they are, I'm going to go and get antibiotics. So what I normally tell them is, it's similar to antibiotics, but instead of, attacking a bacteria, this is attacking a virus. So it's just like a penicillin, but for the virus. That's the way I normally describe it. And that seems to work to most of my aunties and uncles when I say it in that way. Like, this is basically like penicillin, but for viruses, right? Because penicillin is for bacteria. And I think slowly they will start to gain, because the other thing is they also need to see the impact themselves. It's one thing to read about the impact somewhere or to hear about somewhere, but if you to go and take it and you start feeling better yourself, that makes a huge difference. And then that one person can go and tell a different person. It's like, oh yeah, I took the medication and it was fine and I felt much better.
Sorry, Dr. Leg, I've got a question for you.
Yeah, hi, Paul. How are you?
I'm very well, thank you. It's just around the antiviral drugs that you mentioned about curing for the COVID or attacking the virus. So if you have symptoms that are, usually the way we describe it or how we feel about it is how you, like if it's like malaria, you have a cold, can you get those prescription from GP, or can it only be done by any other health profession? Because a lot of people don't know that there is a particular drug that antiviral drug that you can get for COVID.
Yeah, no, it's a great question. Well, yes, so GP can prescribe Paxlovid. So the oral, the tablet antiviral Paxlovid that I spoke about there, GP can prescribe that. Most GPs. If one of the concerns with Paxlovid that it interacts with a lot of medications. So for a lot of elders that have that are on on a bunch of other medications, they might not be they might not be eligible for Paxlovid because it might interact with their medications. So they either have to hold that medication and just have 5 days of the antiviral, the tablets, or if they can't hold that medication, or they can't stop it for whatever reason, then that's when they would need to go to either hospital or a specialist to get a different antiviral, which is not a tablet, it's an injection. But this for a very specific group. But GPs can prescribe the antiviral Paxlovid.
No, thank you for that. The other question also is about the children's. Is there any advice in terms of if kids have with similar symptoms? Because a lot of kids, they get sick. I know I'm not health profession, so I have nothing. What advice would you give in terms of how kids get dealt with in terms of COVID?
Yeah, so for you to get you have to be at risk of progressing to worse disease for you to be able to get the antivirals. So not anyone can get it. There's a very specific groups, as I highlighted before. So it's people that are over 70 years old, or over 50 and they're indigenous, or over 50 and have other health problems. So the kids don't fit into that group because they seem to actually be able to fight coronavirus quite well, as long as you provide good support for them. Obviously, if they're not getting any better, you should take them to hospital and they can go and get assessed there. Okay, but generally speaking, kids seem to be able to fight the coronavirus very well. If they're not doing very well, you should always take them to your local GP, or if you're really worried about them, then you should call an ambulance and make sure that they get the care that they needed.
Is anyone have more? If we don't have more questions, we have more questions.
Okay, I just want to ask one more question.
Mm-hmm. Mm-hmm.
My question is around cultural aspect. I remember during COVID-19, there were a lot of modeling that were done to determine how the progression of COVID-19 in terms of infection within the community would be seen maybe in a month or 2 months. And what happened actually, though, there were lack of cultural considerations in those modeling, the feeling of others about what is going on. And it comes back also in terms of how these clinical trials are being perceived. People talk of, the all trials are made on whites compared to black people. So it's another dilemma that we need to address. And I don't know how would you fit yourself in as a health professional to justify that, all these drugs were comprising of sampling of human, all that are included black and white, and those sampling actually present or could be generalized to different populations.
Yeah, no, that's a great question. I can only speak to a few of the medications that were trialed. So I recall for the remdesivir trial. This is it's a different antiviral. That was the first one that was approved for coronavirus. It was quite a large trial. It was done in the UK, and it included it was a randomized controlled trial. So a lot of these medications do not get approved unless it's done in a randomized controlled trial. And the good thing about the randomized controlled trial is that it randomizes based on everything. So the groups, when they get separated, should be equal in mostly everything. So gender, race, ethnicity, age, all of that. So it randomizes them so that it's equal on both sides. The placebo group, the group that doesn't get the drug, and the group that does get the drug. So the remdesivir, I can speak on that there was definitely inclusion of different ethnic groups, the one that was done in the UK. The Paxlovid, I think it was done in the US, and I can't remember whether ethnicity was a major factor in there. So I can't really speak much to that. But you know, I think you raise a very interesting point. And I think because the coronavirus has impacted basically globally, a lot of these trials have tried to include as much as possible different ethnic groups, different age groups, as well as people from different minority groups.
All right, thank you very much. I'm sorry to bomb you with a lot of questions. Yeah, I just want to ask you also on the, I think the public health unit also will give us some more light on this. It's about the data in terms of CAL communities that are not reflected within the statistics. The death rate due to COVID-19. I met with one of ABC journalists who is background from Africa, and I think he did a piece of work to make some inquiry within the community how many Africans have died. And quite interesting, it was telling people that during panel, UN panel, that there were about 13. I don't know whether that number was right. So I think living and death are also important. How do we actually try to adjust to make sure that we also have data on people that are dying from different ethnicities, and not specifically Africans, but other even CAL communities, so that people are aware. It could even drive the influence for people to assess drugs and manage COVID in a better way. Because leaving the other group outside will tell something negative about them that of course will not influence them actually to know whether or not they are being impacted by COVID-19. So what do we do about the data? Do we have to suggest other ways, to look at the mentality in different groups so that people are aware how many are going away from us? Okay, somebody's presented here, ABC COVID mortality by country, but okay. It's quite interesting. That was on 30th of September this year. Thank you, Nyaniel. Thanks for that information.
Happy to kind of walk you guys through it, but the ABS do collect that kind of data when reporting mortality. And in this report, they've kind of grouped it by region, but you can download and see more information if you're interested. So it's just grouping the countries, not necessarily, singling out countries, but more like regions and stuff.
Okay. I think that people will assess it anyway. Thank you for that. Yeah. I think your question is answered, Leg, or do you want to emphasize on that, the data collection?
No, I think that was very well covered.
Yeah, thank you.
That article. I might have to look at that article myself, actually. I don't know if I've seen that.
Okay, thanks. Yep.
Peter has a question, I think. Is that right?
Yep.
Yes. Hi, everyone. Can everybody hear me well?
Yep.
All right. Thanks, Lek, for the presentation. I think it's one that we really need as the migrant communities, as Mabur mentioned before. The awareness is very minimum, and perhaps organizations like this are kind of crucial. Suppose my question is, I think, to both Dr. Legg and members of the Department of Health. We all know that the government is moving away from or moving towards the direction of normalizing, the COVID management in a way of recommending the measures or the public health measures, which to certain communities, it probably can be perceived as a way that it's not as bad as it was, but we still are really experiencing higher numbers at the moment. That added to the new drugs coming out, which will have their own problems being advertised or being put to people as effective drugs against the management of the COVID. Do you find that there is inconsistency in advising the community that these are the drugs available now that you can use, but one part of the policy is saying that we're going to be living with COVID, so we're moving towards the direction of recommendation, which does that affect the take up of the drugs or the reception of the presence of these drugs?
This it sounds a bit more like a public health question. Maybe some of the public health people here can chime in. Yeah, go. Sorry, someone was going to say something.
That was a very public health question. Thanks, Peter. From a Victorian perspective, so whether somebody registers their RAT test or whatever, I think is what your question is asking. So we don't have mandatory isolations. We don't have anything legally mandating people to do anything, stay at home or report their RAT. But if they do test positive and they notify their GP, they can still access the medication. So whether they, have that approach of staying at home, whether they actually do stay at home or whether they do follow public health advice that is recommended to them, they still have access to the antivirals.
Yes, and does that affect people like Dr. Lek, the doctors, who are trying to see people come, to seek help for this medication, but the policy is actually recommending, it's not enforcing the public health measures, but it's recommending. So I'm talking, is the recommendation of the policy really affecting the take-up of the drugs,
I think Peter's going to add.
So we do have evidence now that there's as many prescriptions of the antivirals as there are registered cases of COVID amongst those who are over 70. That doesn't give us an indicator of how many people are below 70, so in the 50 to 70 category, who are immunocompromised, but it does suggest that a very high percent of those who are above the age category are getting access to the antivirals. I do have some hearing problems. Is that a common one?
Yes. Yep.
Okay.
Yeah, and the other part also, Peter, is that so for the other group that do get that do qualify for the treatment, the ones that are immunocompromised, a lot of the times when they test positive, the specialist will notify them and will send them a script. So when I was working, for example, in rheumatology, that was one of the jobs that we're sort of looking at, is any patient that's under rheumatology that is under an immunocompromising medication. As soon as they test positive, we can see that, and we give them a call, or they give us a call. We tell them, give us a call if you test positive, and then we send them a script ourselves, or they can go to their GP and get a script themselves. So I think that's probably why I don't think you'll see a difference in terms of the medications being taken up.
I think
yeah.
our questions might have ended by now. We just want to welcome the next speaker. Can everyone hear me? Can everyone hear me?
Yeah, we hear you.
Yeah, I'm going to welcome the next speaker. Her name is Wendy. She's a coordinator of telehealth. She's also a psychologist. She's a counselor and a supervisor. She's a member of Australian Counseling Association, and she worked for CMRH as a clinical psychologist, and she's been doing a lot of work during the COVID-19 with the CMRH. She's done a great work. So Wayne, you are welcome. Wendy, you are welcome.
Thank you. Hi, everyone. Lovely meeting you all. Yeah, so I'm working with refugees, and I worked with refugees before, and I worked with people during the COVID-19 as well, and the impact of COVID-19 on people and mental health. And the psychological reactions play a critical role of shaping both a spread of the disease and the occurrence of emotional distress and social disorder during and after the pandemic. So there is many reasons, actually. It's not like psychological factors that play an important role in adherence to public health measures by the vaccine and how people cope with the threat of infections and all these consequences. So it's clearly the crucial issue to consider that's in the management of any infection disease, including COVID-19, how the psychological reactions to pandemic include maladaptive behavior, emotional distress or disruptions, and defensive response for all for the psychological issue and vulnerability. So in this case, we try to, all these characters actually play a big role in people when they have anxiety, depression, and that's actually they are under very high risk because they don't understand what the COVID-19 sometimes and how the infections will affect them, and they don't want to respond to the vaccine. So we're trying to educate these people about how the impact of all these psychological or mental consequences, the impact of COVID-19 on people with mental health. My work as a counselor with people to educate people about how important to avoid to spread these diseases, and how important to follow up with COVID-19 procedure, and how they can protect themselves from spread the disease and to reduce the mental health issue. So this is so important for refugee to educate these people and to to recommend like kind of education and procedure, and to understand, especially with the refugees, they coming from different country and they have lower understanding of what COVID-19 impact on people and spread the virus. Beside their vulnerability, they come with mental health issue. So all these things that we educate them and support them in terms of minimizing individual mental health issue and the impact of COVID-19 to increase the sensitivity of some refugees, like taking the vaccine it's something that's huge for them, you know what I mean? So in this case, educate them, and that's why it's our role as a council actually to reduce mental health issue. Besides, we educate people about how important to reduce the vulnerability of all the other diseases that they might impact on them.
All right. Thank you very much, Wendy, for a great presentation. I think that presentation complement presentation for LEC, and that's why we brought Wendy after LEC, so that the mental health avenue has to be visited. My question will be to Wendy. I know we've been working and we've been identifying some loophole or gray areas. So is service to do with counseling cost effective to migrant, refugee, and asylum seekers? And how do we make them be cost effective to them so that they have those accessibility?
How to
cost effectiveness, because it's costly to go and look for the counselor, yet now there are no services that directly give most of these migrant and asylum seekers. How do we make them cost effective to be able to access those services here?
It's very hard. So that's why people, to be honest, a lot of people, they don't understand what the counselor is, especially people that come from different country sometimes. And they going through mental issue and they don't understand how to reach counselor, how to reach psychologists. It's lack of education. So our center, it's so important. It's connect with people for different areas. So that's why when they going through mental health issues, so they can direct him. That's we have a mental health services here. So that's we can support and help people to understand, to reduce their mentality, to be able to function and to be able to contribute to this country in a very normal way, to settle in this country. So they're already coming with the cost of this. These people, we support them with mental health issue to in very how would I say that, it's very reducing, like the prices, counselor and psychologists now, how much it's the hour rate for each one if they want to reach someone. But when they come to refer them to our organization, they can get all these services, and then we educate him about everything, and we support them mentally and physically, and we connect him for other agency as well. So we educate these people mentally, physically, and health-wise.
Thank you very much.
I'm not sure if that's answer your question.
It answers, but we just want to rush. If there's anybody that would like to ask a question for Wendy.
I want to ask, anyone would like to ask any question? This because I worked with refugee before as well. Yes, Peter. Ask Peter. Yeah.
Sorry, was that me, Wendy?
I want to say the last things that CMRH attempt to support refugees' education in terms of minimizing individuals' mental health issue and the impact of COVID-19, which increase the knowledge and support with these people, how to avoid this kind of diseases and how to support him mentally, and by taking the vaccine and to attempt the treatment and all this stuff. This is what our job as well. Yeah.
Thank you very much. We are running out of time. I think that presents a platform for public health unit that we have in Southeast and Western Suburb to give us, more of what we presented and service available for them in those public health units. So in this regard, I would like to take opportunity to invite Kate. Kate is a director for engagement in Southeast Public Health Unit. As I said before, she has been doing fantastic work. I do receive her update on newsletter and try to feed them, through to Asylum Seeker Resource Center, where we have huge numbers of asylum seekers and refugees that are in need of many services and information. So that you're welcome, and we need to hear from you about the services that are available at your end. Thank you very much.
Thank you very much. Are you okay if I share my screen? I just have a presentation, if that's okay. So hello, everybody. While I'm bringing that up, my name is Kate McGrath, or Catherine McGrath, and let me just share. So I'm the Director of Community Engagement with Monash Health. So it's a pleasure to be here today. Let me just go to my slideshow, and hopefully, can you see that coming through now? Yep, and I think Rob Koch is also on the call, and he's in my team as one of the senior advisors. I too, on behalf of Monash Health, would like to acknowledge traditional custodians of the lands in which we meet and pay my respects to their elders past, present and emerging, and also acknowledge the leaders that are on this call today as well. So maybe just sort of kicking off, some of these measures obviously have been really well covered by Dr. Leek, but obviously one of the key things we have been doing through Monash Health is really trying to get the key messages out through community. So really our most recent one has really been around that sort of protect and connect to care. So really focusing on those sort of protection and prevention key messages that we can share with community, but also around that encouraging connection to connect care. So we've already been talking about the medicines and access to medicines, but also all the LPHUs or local public health units have programs around COVID positive pathways. So people who might need extra support if they're sick. And so I'll talk a little bit about that, but that's really about if people do test positive, there is support through the Southeast Metro COVID positive pathways. As an organisation like yourselves, if you come across community members that may not be aware of that service and you think they need extra support, you can actually make a referral direct through to the Sandringham Care. Whoops, I think someone might be still on mic. So really encourage you, there's sort of some information in the next slide, but that's a really valuable resource to have. Whoops, hang on a minute, go back. Sorry, I've got, I'm not sure if you can see, I'm just going to hide the thumbnail video. So this is a little bit about that COVID positive pathway. So really people who might need some extra therapy, they might be potentially sort of, deteriorating at home and may need hospitalisation. There might be some psychosocial risk factors from the person, and perhaps obviously in terms of vulnerable cohorts. So thinking about there might be people who might have refugee asylum seeker status, quite isolated at home and may just need some extra assistance. So encourage you, in terms of being aware of that program in the Southeast. In terms of vaccination, we have had our vaccination bus that's been running. That's about to finish up this Sunday, actually, at the Sikh Temple in Officer. We still do have some public sessions for vaccination through our hospital sites. And we've also will be at the Palm Plaza in Dandenong. So if you think there are people in the community that still may need to have their boosters, really strongly encourage you to take a note of that. I'm happy to share the information and let you know through our notice board, but there are still vaccine options available from the public health unit. In terms of vaccination, as I mentioned, the bus is finishing, and really from a state sort of health investment, really encouraging people to get vaccinated via a pharmacist or GP. So I've just popped some information there as to how you find it. And we're lucky in the Southeast, we also have the Primary Health Network that currently has a homebound vaccination program as well. We're not sure how long it'll go to in the new year, but at the moment it's still available, and they'll actually get a GP that'll come out to the family home So that's a great service for somebody who may, you know, have access issues in terms of getting out of the house. In terms of some further information and support, really encourage people to sort of get on and have a look at the Southeast Public Health Unit website. Obviously, we cover 11 of the local government areas in Melbourne, so all the way from Mornington Peninsula up to St Kilda and then out to Cardinia as well. So quite a big catchment area, nearly sort of 1.8 million people. But on the site, we have lots of information about public health, obviously vaccination. We have a link to our fortnightly notice board, and that will be updated also with health alerts around other conditions. The notice board that I'm referring to is something that actually Rob from my team pulls together. We send it out every 2 weeks. We will probably have a bit of a break over the Christmas period, but really we try and have some key messages, access to resources, lots of links to sort of translated resources, and also resources that communities have developed as well. And you can sort of scan the QR code, or you can sort of email us through and we can send through the link. So my team also supports health education sessions. So really we can support kind of people doing sort of different topics. We're lucky in Monash Health, we can sort of lean in and link in and find kind of experts around particular topics, or we also work with other organisations who we can help link community organisations to. We do have an expression of interest form, so I encourage people to sort of register and give us a little bit of notice so we can sort of work out who is the best person to organise for a speaker. Monash Health, Refugee Health, important for you to note, obviously Monash Health does have a refugee health and wellbeing service, and if you're not already connected to that, please be aware that that is available in terms of primary care and support as well. So it's just good to know that there are things like that that are in the community. And my team, so as I mentioned, Rob's on the call, but we have 4 other advisors as well. So everyone's sort of happy to kind of, you know, take sort of calls or emails in terms of kind of linking in for support. And I'll just sort of pause there. I mean, really today was just sort of, do an introduction, but really wanting to thank you and the work that you are doing around protecting yourself and your community against COVID. But happy to take any questions or any comments, or maybe Pete could talk about the West and then we can open up to comments across the two. Thanks.
Yes, thank you very much, Catherine. I think we will have Peter so that we have your question all over to you. So I would like to welcome Peter to give a bit of presentation from the service that they're delivering the Western suburb. Of course, Peter is a community engagement and partnership manager based at the Western Public Health Unit. Peter, over to you. You're welcome to give a bit of presentation. Thanks.
Thank you. And I'll see if I can share my screen, and thank you for the welcome. Let me just, if someone can tell me whether they can see those slides. Yes, that's thanks, Rob. I'm a member of the Community Engagement and Partnerships team, so I'm the manager thereof, and we would always begin with an acknowledgement of the traditional custodians of the land on which we are meeting in the West, which is the Wurundjeri, Boonwurrung and Boonwurrung peoples of the Kulin Nation, and we would pay respects to elders past, present and emerging. So we cover the catchment, which is the west of Melbourne, which covers a set of local councils that begin with the letter M. So we have Melbourne and Maribyrnong and Melton and Moonee Valley, and the council formerly known as Moreland, but is now Marybeck. And so that's 1.3 million people. And so we cover the city of Melbourne north to the Fawkner Cemetery, the northwest to Sunbury, and then all the way down to the You Yanks, Little River. And so we are unique in that nearly 40% of the population are born in other countries. There are more than 200 languages spoken. We only have one Aboriginal health service. We have 2 points of entry. So we have a complex set of populations, and we have 6 major public health services. So we have the Parkville campuses of Royal Melbourne and Peter Mac and women's and children's hospitals, as well as Alfred, and where I am today at Western Health. Complex, but we also have good support. And so our mission is to protect the people in the West, create healthy environments, address health inequities, promote well-being of our population. In many of these respects, we are just, as Kate has expressed for SEFU, except Kate does it better, and we aspire to be as ambitious as she is, and to address all the things that she addresses and more. So we are. This is an image of the Joan Kerner Women's and Children. They're in the colourful bits. We have an emergency department, and so this year we've had nearly 400,000 registered cases of COVID in the catchment, and so that's probably only 40% of the population, but we think it's probably more than 2/3 of the adult population now being exposed to COVID. We've had more than 200 outbreaks. I giggle, but it's been disastrous. 200 outbreaks in residential aged care. So we've been kept very busy in the last period of time and learnt a lot about public health, starting with COVID. But what we're intending to do is to broaden our activities to include a whole range of respiratory illnesses, communicable diseases, as well as health improvement, population changes, environmental health. And so at the moment we're worried about mosquitoes, thunderstorm asthma, Mpox, and then we're intending to spread our focus of effort into a set of other communicable diseases, including chlamydia and sexually transmitted diseases. So we will be busy in the next period of time. We are just a small team. So as Kate has said, she has 5 or 6 senior advisors. We're a similarly sized team. We're a team of 7. We have a photo there, so that's Nanielle in the centre there. We have a team of 7 from 4 of the different continents of the world, and we have family members that cover 6 of the 7 continents, and there's not 7 habitated continents, so only 6 of them are habitated. No one lives in Antarctica, but behind me is Iceland. So we like to think of ourselves as international and capable of bringing a world of experience, but we like to engage with communities on their own terms. And we want to talk about things that matter. We want to give helpful advice. And so we have teams that have backgrounds in health sciences. So we have fabulously qualified persons with Masters of Public Health, degrees in medicine, who can, but who have the gift of being able to talk to people at a level that they want to be spoken to. And we listen. So we care about things, and we want to improve things. And so Kate's outlined some of our tools of trade, which are, we provide fact sheets in language. We provide information sessions, either with or without translators in attendance. We assemble people in groups and in circumstances where they are comfortable, and who are happy to both receive information and give information. And we want to do more of that. So the skills that we bring are good, but we still have a lot of work to do, and we need to team up with new community groups wherever we can. In terms of immediate local services, we are doing, if you're anywhere near High Point Shopping Centre in the next week, maybe if you're Christmas shopping, if that's something that you do, you can drop in and get a booster if you're eligible, which is always tricky. It's got to be 3 months since your last shot and 3 months since you've last had COVID. But if you are eligible, please get a booster. And so we're operating daily there, except Christmas Day until the end of the year. We're operating, as Kate has suggested, if there are people who are homebound or difficult to get out of where they are at being at a residential aged care facility or a disability support accommodation setting, we can send a team in to give them vaccination coverage. We also have, for immunocompromised children or infants, we have a facility at the Joan Kerner Women's and Children's Hospital. So this is both a Western Health and Western Public Health unit set of initiatives. And we also have, and this is sort of relatively new information, as Kate has said, the state-funded set of activities in relation to vaccination and testing are changing. In the West, we will continue to have GP respiratory clinics provide PCR testing. And so everyone can get access to free RATs if they need them. If they're eligible, they can get them from their local councils through libraries or customer service centres. If you're a community group, we will provide them to you if you have an arrangement with us, and we are open to doing that. Otherwise, testing, at least at the PCR end, we have 9 respiratory clinics. Most of them require appointments, but we point particularly to the CoHealth Western Melbourne Respiratory Clinic, which has a preference for appointments, but which does also do walk-ins. And so we'll look to update our websites on some of these details in the coming period of time. But if I can just say, we might tidy up these PowerPoints and circulate them as I'm assuming Kate will do for CEFU. And so I'm Peter Fitzgerald. You can email me, you can call me. We're here to help, and we specifically want to be of a practical help nature. And going forward, we want to do it not just COVID, but an extended group beyond that. But in which case, I might stop sharing and suggest questions, perhaps.
Oh, that was great. Great presentation from Kat and Peter. I think you would have a lot of questions to ask Kat and Peter across those presentations. Anybody? The floor is open, please, to ask questions. Thanks.
Yeah, thanks, Kate and Peter. That was great, actually. I would have just a quick question for both of you, which actually follows up for the question that Mabur asked me earlier, that ways in which the services that you guys provide can reach communities such as ours, the South Sudanese communities. And I saw that you guys sort of hold information sessions. Was there any particular ways that you guys were identified? Like, are your flyers in GPs that some of our community members go to, or anything like that?
I might say that we've been reactive to opportunity, but we probably need to be more organised. So I think if there have been different phases. So this time last year, the phase was get everyone their second dose, and see whether we can get a third dose started. And we would just be responsive. Anyone who put their hand up, we'd give them a pop-up option to bring community groups in. I don't have from memory all of the interactions we've had with South Sudanese, but I would invite Naniel, who's hiding in the darkness there, to offer those. But going forward, I think we do want to establish mechanisms whereby we can have not just COVID but non-COVID discussions of health. Naniel's going to jump in.
Yeah, just quickly. So we have a really strong partnership with our community health organizations here in the West. So we had a partnership earlier on in the piece with IPC Health, where we had bicultural workers that were employed with us but sat with the community health organisation, and they had better reach into the community that way. And so community were, really going out to the Footscrays, the Sunshines, and talking to community and really giving that information and meeting them where they are. I guess we haven't been as forward-facing as a unit to the community as of yet, but we have definitely gone through our partners and those who have existing relationships with communities. Yeah.
Maybe I can add from the Southeast. So thanks, crew. So yeah, I mean, we've been, working through sort of local agencies, excuse me, around engagement. So some of that has been where some of the community groups have received funding from the Department of Health. And so we then try and work strategically with those organisations that have received funding to engage their community, to look at how we can work together around sort of pop-ups or community information sessions, making sure that they've got access to things like rapid antigen tests and the masks, and so things like that to sort of support that. Sort of during COVID, we also we have a South Sudanese Community Support Group in the Southeast. So that's delivered by the Centre for Multicultural Youth. So we work quite a lot with the leadership group there around kind of information sessions, kind of community-led sort of pop-up kind of vaccination kind of clinics. And yeah, really look at, I guess putting on the table where can we help support that engagement, knowing, as community leaders, kind of, knowing your community, and really it's about how do we sort of get in behind. And I think, as Nanya said, we've also linked into kind of like bicultural workers. So agencies here in the Southeast, there's a bicultural worker network and a community champions network. And so a lot of those people that participate in that are then sort of getting access, I guess, to kind of regular community updates through speakers. So Monash Health has had like a nurse that usually participates every second week around kind of info sessions. So yeah, trying to, I guess, to tap into all the different sort of, networks and resources and meetings, and sort of through some of those, relationships with community. But I think, as Pete said, really, we're happy to kind of, look at where we can provide support. So sort of as a needs identified, happy to link in. And we've just run a program here in the Southeast with sort of 19 community organisations, and there were some South Sudanese organisations that participated in that. And it was around sort of building capacity in multicultural organisations. And we sort of ran some focus groups to identify kind of issues, health issues, and how we can best respond and engage community. So that's just finished, and we're just doing the evaluation around that, and keen to kind of, do another program around that as well. So we'll, keep this group updated around future programs.
Just wanted to ask a question in addition to what was asked. We know the other consequences of COVID, the topic we are covering, is mental health, and which was pre-existing issue in the community. Are there any programs around the communities that you're also undertaking beside just COVID? And are there any specific avenues that you're reaching out to the community?
I might jump in and say I feel that's probably a gap in our service response to COVID, other than the immediate COVID positive pathways, which is very focused on immediate treatment. There's certainly gaps in two other areas. The two areas that are most specific is long COVID. So there's not yet a systemic longer term response to COVID, long COVID. So recurring symptoms and the health consequences of having had COVID, some of which would include either exacerbation of mental health or triggering of mental health issues. So I think I'd be thrilled if I was to hear I was wrong on that, but I don't feel that there is a systemic response nor a particularly localized response. There had been some investment in pediatric mental health support, partly through schools, but I think that's now, well, actually the Commonwealth have changed the rules back to limit that. Wendy might have more of a view on that.
Based on the recent research, it's 54% of response related to psychological impact of moderate to severe anxiety symptoms. It's impacted from the COVID as well. So there's a lot of, as well, the 70% of reported moderate from 194 sites from China's January and February 2020. That's the COVID impact on people mentally and physically as well. So COVID has played a big role in people mental issue. And we know that for a fact, mentally, physically, and financially. So there's a very correlation between mental health issue and COVID-19. And we know we went through this in different stages. And I work with people during the pandemic, in clinical psychologists with people, they went through so much suicidal, actually, there's a lot of them as well, and loneliness and depression, and they're living by themselves, there's no support, and they can't reach anyone. So COVID has actually played a big role in mental health problems. Yeah.
And just one thing that we were looking at doing, Peter, was I think we just did a session with Community in Abundance, which actually Rob participated in, and we sort of tried to, they were doing some work around, I think, NDIS, but we just sort of linked in with each who are delivering sort of the Partners in Wellbeing program, and Rob might kind of comment on that, but that we're finding, even from our sort of the focus we've done, like mental health does come up as a pretty big topic of concern and a key health issue, but we're sort of trying to tap into sort of some of those things that have been funded, like the Partners in Wellbeing and other things to kind of link community into. But Rob, did you want to make a comment on that?
Sure. So the community abundance training that they have, we went along to that, and they were particularly keen to have someone speak on mental health. With there've been a few acute issues that have happened in the community, so we reached out to each to partner with them. They have a clinician who specialises in mental health, and she's actually from Africa herself, highly qualified, and there's no one solution to this, of course, and a lot of people won't reach out for mental health help unless there's a relationship established and someone maybe holding their hand to actually get there. So, like Peter said, a lot more could be done in this area. The coronavirus website, of course, lists a whole lot of supports, the mental health hubs, etc. They would be worth exploring for sure.
Okay, I just want to thank you very much, Rob and Catherine, for responding, and Peter and Yaniam. I just want to ask a question, similar question, but I just want to bring something up as evidence, and we'll discuss about this. Let me share my screen, if you don't mind. Okay. Share the screen. All right, this is the data that we've collected, the center over, I think, 1 year. It was within 2021 to 2022. This data actually was given ethics approval by Australia National University, and one of the doctors that is making this study is Dr. Grant Dutt. He's a fellow in health system, College of Health and Medicine. So I'm also co-authoring this, and running title is Vaccine Hesitancy and Mental Health. And it was among Africans, of course, the data was driven, and majority were women. And looking at the data, you would see support given was good. And then my concern is this correlation here. A negative hesitancy toward the current COVID-19 vaccine or the future vaccine, 54.6. And we are positive, which is 45% acceptance, towards COVID-19. We use K10 scale to analyze this data, and you could see the weight here, nervousness, anxieties are quite high ranking. This is a correlation between COVID-19 and anxiety, mental health, including hesitancy toward COVID-19. And I believe this requires a very great work from public health unit. So what recommendation as far as Victoria Royal Commission into Mental Health, our public health unit trying to incorporate in their work to support the community? Because basically we are seeing a lot of anxieties and depression and even suicide, within these communities, and they're not being revealed outside there. It's good that our manager from Department of Health is here tonight, to hear from, members of the communities. I just want to know this correlation and how to work it out to make sure that we address issues of mental health with concentration of Victoria mental health into Victoria recommendation to mental health. Thank you. I will undo my screen and you can answer it. Or do you want it on?
Sorry, Mabor, it's 8. Is that,
sorry?
Oh, sorry. Just in regards to the that evaluation, is that something you're happy to share? Because it was a little bit hard to see on the screen, but it'd be great to be able to have a read through if it is something that's public.
Yeah, it's a data analysis. I not yet published. We are trying to analyze it now. The data is analyzed. We're writing a paper.
Mm-hmm.
Yeah, but we can share it later on when it is out. Yeah.
Yeah. No, that's great.
Mabor, I've got a question. That was a really great piece that you showed us there, and I'm like Kate would be interested to see and read more. I guess my question would be, what was the research question and some background as well? Because I think mental health is a huge public health issue, and it's not lost on us how big the burden of disease is within our community in particular. And so it'd be good to get an understanding of how the paper kind of thinks about COVID-19 vaccine hesitancy in particular in relation to mental health.
Yeah, thank you very much. I think the research question is basically, does COVID-19 affect mental health of African Australia, specifically South Sudanese, during pandemic? That's a research question, and give us a running line title with vaccine hesitancy and mental health, how this correlate. So looking at the other factors that were considered, we also look at some contextual factors. I also look at confounding factors, that would hinder the outcome based on social determinant, free and forced. If I talk about free and forced, during migration, we do have, as migrant or refugee, we do have different social determinants that actually affect our mental health. Moving towards COVID-19, it became different. So we put those factors into place. trying to make sure that we measure the depression and anxiety during COVID-19. I don't know whether I'll answer your question. Is it okay, Danielle?
Yes, you've definitely answered the question. I think it's just kind of a lot for us at the LPHU land to sit with. Yeah, I'm not sure, Kate, if you have any comments on what's going on in CEFU.
Yeah, I mean, in terms of kind of LPHUs, I think probably one of the critical things, you know, and that we're looking at embarking on in kind of 2023 is developing a new public health strategy for like the Southeast. So I think that's some data, like being able to share some you know, the data that is captured from across community and those community insights sort of does need to feed into that strategy. So I think for me, it's a bit of a reflection on, you know, when we think about the engagement we'll need to do, and we hope we'll have some sort of not dashboards, but really, I guess, some data snapshots that we'll have across sort of local government areas and, you know, groups and places, how we might need to sort of drill down in some of the data, but also like linking with community data kind of insights that you do have as well, which I think will be really important as part of that process, as we kind of, you know, identify what are the, you know, the top strategies across kind of the catchment, but recognizing we're going to have we still need to have that place, like, you know, 11 LGAs is a massive kind of remit for the local public health unit. So then how do we make sure we kind of really in-depthly know kind of places within the kind of the catchment and where we need to focus. So I think for me, it's about realizing, or, you know, recognizing that there is these pieces of work that are happening and some of these insights that we really need to make sure we pull into that strategy going forward, because that'll be sort of the next, you know, the next 3 years. But also about the work we possibly need to do, you know, back into the, you know, the health service as well. So thinking about, you know, obviously, as Pete said, we sort of got that, if you sort of talk about sort of the suicide space, that's very kind of the acute end of the system. So we want to be working more upstream in that prevention. So, you know, understanding, you know, where we do have some pressure points, how we could work more at that sort of prevention protection kind of end, before, you know, we get to that more serious kind of end around, particularly around mental health. So I think there's, yeah, a lot of work we can do in that space. And I think the other thing is, you know, noting with kind of the Royal Commission, there's a whole lot of work, you know, that's happening around that, that lived experience, but also a lot of co-design work that is my understanding that will happen as part of that. Just having a chat to a colleague this week, actually, who's gone into that area. So I think if we can, you know, share and kind of make sure that groups like yourself are connected to those pieces of work and how you can feed in, I think that's an important part of like the local public health unit as well, helping you kind of navigate, yeah, what is happening, if that helps, Mabel.
Yeah, that's fine. I think that actually is, you know, ethical approach. I can share it with you and then keep it with you and look into those, and you can even help in terms of how best we can analyze it. But now the web is going on. I will share it with you, Peter, and Rob, yourself, and Yanial too, if you want it, so that you have a rate, you know, of what we're doing so far. Yes, there are great minds, you know, behind this, and I really appreciate, you know, people that collect the data, especially one was involved from Deakin Uni and Melbourne Uni, and try actually to tap in, because I know you're doing a lot of work, fantastic work over there, the local public health unit, the Department of Health. But again, it's high time that we establish as community members, you know, should you have knowledge, then you can do something. Like some of us here, we're working with the Department of Health. Peter, we're colleagues during COVID-19. I did clinical epidemiology, master's from Sydney and master's public health from Sydney, from Melbourne. Those are quite what qualification that you need to utilize to help your own community, you know. It's a knowledge that is available for one to use and to help and to be helped, you know, by the people that are involved. So anytime we are here to volunteer, and give something out there. So thank you very much for that comment. Any more questions before we proceed?
I just want to say something about the mental health issues going sometimes. Like, it's working with these refugees people coming to the organizations, referring from other people from the same community. It's very hard for them to direct them to other place. They will never go anyway. So they know this is where they can speak the language, where they can see people support them from the same mentality, same thinking, because it's very hard for these people to connect with other places. Even now in Australia, you can see I work with a clinical psychologist, 200, 300 people on the waiting list, and there's a lot of high populations that's waiting to reach psychologists or counselor or psychiatrists sometimes. And these people sometimes coming homeless, so it's people coming with vulnerability and they need immediate support. So they feel more comfortable like coming to the same place where is people in the same community, same background. So that's what reach these people where they feel more comfortable mentally and physically before they start get into their sessions. So it's so important to reach people to the right place, to the same community. This is, I can say about refugees.
Yeah, I do agree with you. Cultural specific services are quite important. Yeah. And I
try to refer other people to other places. No. I don't want to go anywhere. I want to come here. And sometimes they reach people. Sometimes I refer them to people who speak the same language. Like they feel more comfortable, like more home. That's what they can accept and adapt, and they continue. And I work with people at the start was very hard for them to connect, but after that, when I reach them with other people, they start speaking the same language and they start accepting to go through all the sessions and start changing. Yeah, that's so important.
Thank you, Wendy, for the comment. I don't know whether do any break or we just proceed to finish it up.
I just want to say something. I've heard people talking a lot about mental health, and I've been listening. Just want to contribute something a little bit. It's like a question, but it's like contribution also. In terms of my background and my experience working with COVID during the COVID-19. I work with community health, Richmond Community Health Center as a liaison. We did amazing work, and I've seen the experiences that I've acquired. Wish I could utilize them to other community. They are very useful because what we are looking for now is what is going to be the outcomes of 2023 in case COVID-19 comes back. What are the things that have been outlined as a solution apart from counseling or apart from research? What are the key points that are put down for the community that is going to help community to actually help them from COVID-19? And I do like to share a bit of experience, because I do know that the only people that can help people come out of COVID-19, it's the community itself, the use of community leaders and community itself, navigating within the community to select key points, key people that could communicate the same language within the.
Yeah, I think you're frozen, yeah? She has dropped. Okay, are you back? So I think Martha, that is a good question. I think that comes back to resources. It depends how much resources are available outside there to support the community. Personally, I find it very hard, working as a community leader, and also juggling with other things of my life. Running this organization is not easy. So it's quite tough. There was a day when I left from here and then I went to a train straight away. I forgot my card. I was fine in the train. And just imagine going to Dandenong and like doing it voluntarily, you know.
Yeah, by yourself.
It's just a
That's-
commitment. And this is what I'm facing now. I think you would attest, you know, when I call for volunteers to come and work, they say, how much are we there to be paid? You know, it's not about the payment, actually, it's about how much you can give as a commitment to yourself. So it comes back to resources, and then, you know, how committed the community to help themselves. I think we'll leave it at that, and we will try to advocate and make sure that people have to volunteer and do some work, you know, for the community. Yeah. So
we can.
Yeah.
We can organize something like, call it community leaders training. We can call it a training, and can give them, like, they will have certificate. If they don't get paid, they will have certificate that they will work somewhere. It will be easy for them to get employment if they have to apply for work somewhere. If it is organized properly, like training and workshop, I think it's gonna work. But my point is, having to come out of COVID. If COVID comes again, what will help communities? It's having a lot of volunteer community leaders, community liaison being used to go back to the community and be able to convey the message of the prevention itself, COVID prevention.
That's right. Yeah. I think Catherine can give you. Are you asking a question or you want to answer?
I guess it's probably just a comment. I think when Martha, I think it's sort of like kind of not when, but probably like, sorry, not that if COVID comes again. I think the reality is we're probably going to continue to have, these kind of surges that do continue into next year. So it really is thinking about, I guess, that it's a bit of a given that we'll continue to have COVID, in the short term. And I think this wave has been, an interesting one, I think, because there's so many different variants. So I think thinking as a community about what does sort of next year, look like, that we're going to continue to have this space, and how do you support community through that, and, how we can kind of work together around that is probably, a key piece for me around that discussion. Because unfortunately, I think we were in a meeting today and it was sort of like, oh, the next wave's expected in March. And so I think it's hard for people, and it's tiring. But I think the reality is, how do we sort of work together so we can get through these bumps when they do come? And what does that look like? Yeah.
Thank you.
Thank you.
I think that's the best comment. Yeah. Thank you, Catherine. Yeah.
So it's just the last things I would like to say, if you don't mind, maybe. As a community, we are actually the bridge between the people who's coming from different country to settle down, to contribute to this country. We don't want him just stay in this kind of struggle. We want him to do something. We come here to settle down, to find their identity, and to start contribute and benefit. We benefit from these things. And that's what benefit us and benefit these people that come from different country. That's our job.
Thank you, Wendy. Yeah, I think we've left with few people. We're better off just finish it quickly and then we go. I'm not trying to dictate anyone, but you can break, whenever you feel like to get some water and then come back. We have a few invitations that were made. We invited BMC and no one responded. They are important people in our community. What we say here is what represent them. And of course, if they don't have time, it's a time of Christmas. That's fine. And we also have, people from the Department of Health, the manager of CAL Communities. John, I don't know how to describe John honestly. It's John that brought us back to this light, and Peter would attest to this. I know John personally has been working during COVID-19 and even before COVID-19 with the communities, and somebody that is quite humble, he lower himself, it doesn't look as if he's working with the government. Just go and knock at the door and say, what do you do? I need to hear from you. And this is the essence that we want, actually. And I really felt good that, it's a man that was given a task as a manager for CAL Communities. And he committed himself to come tonight and see what we do. I just want to acknowledge that, part of what we do here is, was supported by the department through the multicultural funding, which is quite good. It's honestly something good. And with shout out that I can give to his team, especially Jomi. It does call in the morning, 9 o'clock, Mabur, are you awake? Then I said, yeah. What have you done? Let me just try to hear from you. I felt good that there's somebody that is, trying to, to honor what I do, give me that time at least, to be busy, because it doesn't mean that, it's not good sometimes to be idle within the community. And I just want to give, acknowledgement to your work, Jomi. A big shout out. Thank you very much for your commitment. Without you, this would have not happened, to be honest, because sometimes when you call me, I feel tired and you tell me, please do some work. And thank you for that, for pushing me around to make sure that I do this. It's a great work. And our sister also, Fatima, is one of the great person I know. She has really worked during the COVID-19, and her contribution actually is known in the community. And with that, actually, I would just like to invite John to give a bit of comment, about what they want us to do moving forward. John, you're welcome. Thank you.
Thank you, Mabor, and very kind of you. Very much value the partnership and the connection. So very, very, very kind of you to say those nice words of not just myself, of the team. So very much appreciate that. Can I first also begin by acknowledging the traditional owners on the lands on which we do meet and pay my respect to elders past and present. But also can I pass on my personal and my team's respect to everyone on the call here. I think COVID, as we all would be first to acknowledge, has done some terrible things over the last couple of years, but what it has done, I think, has highlighted the important role that community leaders and faith leaders and community organisations play in supporting their communities to get through some challenging times. So I do want to acknowledge the countless hours and the countless amount of time and energy that's gone in from community in supporting not just their own communities, but also other multicultural communities during what has been such a terrible period of time. As I think Kate mentioned, we are going to see some peaks and troughs and waves of COVID continuing, but it's how do we work in partnership together to address those waves, and how do we take some of those learnings from COVID to ensure that we continually learn and build on the positives that have come out of that. And we're pleased to be able to provide some funding to organisations like CMRH in order to pull events like this together. But I think one of the key elements in moving forward is the partnership, and it's fantastic to have both Peter and Kate and their teams on the call here today, because not that long ago there were no LPHUs, there were no local public health units, and now we've actually got a fantastic array of dedicated people in the local areas whose role is to support the communities in their local area in some challenging times. So I think in terms of an outcome of COVID, that's a fantastic opportunity. I think moving forward to really encourage and support that local engagement, that local connection. So we'd very much encourage that collaboration to continue moving forward. I think the other opportunity that through COVID is there has been some real connections and real partnerships that have been set up with community and departments. Even though COVID itself might have been an unforeseen or once in a generation or once in a lifetime event, I think there are some learnings out of COVID that can support emergency management response in things like floods, in things like bushfires, in things like heat waves and the like. So hopefully some of those learnings will transition into the work that needs to be done when those other events take place, and that we don't go back to square one of asking the question, how do we tap into community, but actually that there's also some established partnership already in place. I think there's definitely opportunity to capitalise on that. But look, from our perspective, just very quickly, just wanted to thank you for the time to sit in on today's conversation. We're very keen to do two things in our engagement work. One is obviously to help share important information around COVID safe behaviours, and we obviously had a real good opportunity to hear that. So thank you, Dr. Leek, for your presentation, and thank you to our colleagues across the LPHUs. So, that message around, maintaining your vaccination status, wearing a mask if you're going to a place that you feel you need to, keeping the fresh air operating, managing your COVID symptoms at home, and getting medication if you're eligible, getting tested for any sign. That's something which we can all continue to do, either with or without mandates. So I think that there's a role that we can play in supporting each other around that. But I guess the other element which is of equal value for us is to hear directly from community and organisations like CMRH around, what are the insights and what are, what's the feedback from community that we can, hopefully take those insights, take that feedback, take that advice, take those suggestions, and help inform our colleagues in the department to better design policy and program implementation. So we very much value the conversation today and very much value the opportunity to keep on speaking and meeting. But again, there is no doubt in our mind that the success that we've had in dealing with COVID has been, very much reliant on the great work that's been done by community leaders and community themselves. So in closing, thank you so much for that, and we very much look forward to working with you as we continue through the challenges.
Thank you very much, John. That was a great statement. I guess, Peter, has been acknowledging a lot that, we need to work with John, like asking you every time, but there, Peter, John is there today. But before inviting Peter, we also have staff from a Department of Justice and Community Safety, and they're really working on important work on South Sudanese Expert Working Group, and their current work actually is working with the young people to address over representation of kids within the justice system. We are parents also that also indeed present here, like Monica Majak, that who has been so much into advocacy of young people, because she's a living experience. But of course, she has a lived experience about one of our son in the prison. I think she will ask a question she will ask a question later on, because last week actually she was asking a lot of questions for UN panel that came here for a visit. And it's important that they will be around here. So we invite them actually to look into how they're also informing these young people in prison now to get involved now and beyond COVID-19 on how they themselves actually be help in terms of understanding, COVID management and also, vaccine that's around. So without further ado, I would like to invite Joseph Pips from Department of Justice and Community Safety. Joseph, over to you.
Great, thank you so much for that really warm introduction. My name's Joseph Phipps and I'm the Manager of Priority Projects in Youth Justice in the Department of Justice. Apologies for my blocked sound today. Some of the allergy season still hitting me a bit hard. I'm here today in the place of Dr. Santino Deng, who is the chair of the South Sudanese Australian Expert Working Group. Dr. Deng is having a well-earned break back in South Sudan, but he'll be back after Christmas. But in my team, I would also like to throw to my colleague, Cecilia Lockie, to introduce herself as well before I take the group through a short presentation.
Thanks for that, Joseph. Good afternoon, everyone. So my name is Cecilia Lockie, and as Joseph mentioned, I am part of the South Sudanese Expert Working Group, and I'm employed by the Department of Justice as a policy and support officer. And prior to that, I've worked at Parkville, as many of you know, the youth justice in Victoria, and I've worked with a lot of our young South Sudanese young people, in particular boys over the age of 16. Thank you.
Thanks, Cecilia, for that. So what I'm going to do is that I'll share my screen and I'll take us through a presentation. So just bear with me while I do that. Is that all showing now on everyone's screen? I'll take that as a yes. So essentially, I'm going to take us
No,
through.
Joseph, we can't see your screen.
Oh, you can't?
No.
Let's try that again. How about now?
Yes, we can.
That's great. Essentially what I'll do is I'll take us through some of the data and then talk a little bit about the actual project that's been established, which is the expert working group. As many people will know, the South Sudanese Australian young people are overrepresented in the youth justice system. There's been a significant increase in the representation of South Sudanese Australian young people in the system over the past 8 years. This graph here shows that there's been quite a significant increase overall in the numbers, including a large number or a large increase in the numbers of young South Sudanese Australians held on remand. So what that means, that's when a young person's been arrested and charged with an offence, and the decision the court has taken is not to release the young person on parole or on bail while they're waiting. So they're held in custody waiting their court case. But essentially, the figures also indicate that there has been a slight decrease in the last financial year, but we think that that's probably representative of overall the numbers being reduced because of the lockdown. So our data people suggest that overall the increase is still, the overrepresentation is still likely to be increasing. So essentially, in terms of the regional breakdown of where these young people come from, they're predominantly in overwhelmingly in Metro Melbourne, and predominantly in the regions of the West and the South Metro. So together, the West Metro area and the South Metro area have about 83% of the South Sudanese Australian young people who are under youth justice supervision. Another interesting figure to point out is that South Sudanese, just a quick mention of the terminology actually, because of our data system and because the fact that South Sudan became independent relatively recently, sometimes the data in our system records young people who are South Sudanese as being Sudanese. And also it's a complex picture with if country of birth is taken as an indicator, we know that a lot of South Sudanese Australian young people, their families or they themselves were born in countries outside of South Sudan, but they are South Sudanese. So that's just a quick comment on that point. But essentially on the right, you'll see that South Sudanese Australians are overrepresented in remand, but they're significantly underrepresented in terms of being able to take diversion, which is a process whereby instead of going through the youth justice system, there can be a process whereby a young person's diverted early on away from the youth justice system and through the Children's Court Youth Diversion Program. So that's some of one of the preliminary data is indicating to us that there is a statistical difference between South Sudanese and Sudanese Australian young people and other young people in terms of their journeys through the justice system. So in response to this issue and following strong advocacy from the South Sudanese Australian community itself, the government has established through the Department of Justice this project, which is the South Sudanese Australian Youth Justice Expert Working Group. The Expert Working Group will run for 3 years until 30 June 2025, with a funding of $5 million to really deliver on 3 key pillars. The first pillar is around identifying actions to support young people out of youth justice. So it will do this by, over this 3-year period, conducting a case review of the files of young South Sudanese Australian young people to really gather that data around what some of the drivers are of their contact with the youth justice system, as well as looking at some of the criminogenic protective factors. Will also be, the expert working group will be conducting private sessions or private interviews with consenting young people and their families. And this will help to develop an individual case action plan to support that young person to access practical help, including support for their families. But it will also provide an opportunity to gather that whole of system evidence base to show what is working and what is not working across government. The second pillar is around strengthening the South Sudanese Australian community sector. So the expert working group will do this by engaging directly with community organisations, religious groups, parents, carers and young people with lived experience. And there'll also be an aspect of community investment funding and grants to be provided to South Sudanese Australian community-led service organisations to help build their capability and capacity as an effective support in the community sector. And we will also, the third deliverable, I should say, or the third pillar is around really, as part of the 3 years, gathering all that information and evidence to recommend systemic improvements and monitoring those individual case action plans. And it will do this by being able to identify and validate what are the drivers of overrepresentation and what are some of those potential solutions. But really also through the whole course of this project, the voices and experiences and expertise of the South Sudanese Australian community is at the heart of the project. So I'm going to show now the governance structure. So as I mentioned, the chair of the project is Dr. Santino Deng, who's a prominent South Sudanese Australian academic who has a background in, his PhD is involved with counselling and trauma-informed practices, particularly with families and children. So he's been appointed to the position of the chair, and supporting him in his role as the deputy chair is the principal commissioner of the Commission for Children and Young People. So both the chair and the deputy chair are supported by two teams, one sitting within the Department of Justice and one within the CCYP. And then there'll be two separate bodies providing advice and strategic information to and from the chairs. So there'll be an interagency committee, which has been established already with a representative from the Department of Health. The interagency committee will be comprised of very senior level representatives from across government, including a representative from Victoria Legal Aid. And the IAC will be the way really for those high level whole of government recommendations to be considered during the course of the 3-year project, and will also be the opportunity to provide some of that really cross-government data around some of the factors, including education, including education, exclusion from education, access to health, issues around Victoria Police data as well. They're a member of the IAC. There will also be an advisory group established, which will have on it young people with lived experience, as well as South Sudanese Australian community leaders, as well as academics who have particular knowledge and expertise around youth justice issues impacting African Australian young people in Melbourne. And the chair and the expert working group report up through the Deputy Secretary for Youth Justice and ultimately to our Minister, with the Youth Justice Commissioner, Andrew Davison, playing a project champion role for this project. The project is a priority for government generally, and is actually one of the Premier's, Dan Andrews's, personal priorities to deliver on. We would all be aware of the recent incident and the news coverage that this is a very live issue, and it's something that the government is taking incredibly seriously. And even though the youth gang violence issue is not, it's certainly not isolated to South Sudanese Australian young people. It's a broader issue that will need to be addressed through government, because it's not just, it's children from a number of backgrounds that are participating in this behaviour. So the expert working group will of course be examining gang or so-called gang activity, but the response to the overall youth justice gang issue will be something that the government will also have to look at more broadly, because as they say, it's not a South Sudanese issue. It's a broader community issue that has to be resolved. And so in terms of, if anyone would like to find out more about our project, I'm just here doing a spiel for Santino when he's not here. If you just Google South Sudanese Australian Youth Justice Expert Working Group, I know it's a bit of a mouthful. We do have our website, and it's actually accessible in a number of community language, Dinka, Niue, and Juba Arabic. And that's our email address. So I'm very happy. I might actually paste in the chat actually the link to our website, so you can contact us if you are interested in learning more about our project. And yeah, that's essentially the overview of the presentation. Does anyone have any questions that they'd like to ask at this point? Wonderful.
Yeah, I just want to ask a question.
Yeah, of course.
I remember last time this presentation was done and I was present, and I won't ask that question again, but I can ask a question for benefit of the audience. Especially when we talk about case review and session that you would provide to individual inmates or ex-inmate, we found out that myself, there's the issues of case review where you make it with individuals, because there are biases that you would consider. We really done some work in 2007 with Sudanese Mothers Coalition and Lost Boys. We invited the Parliament House to give a presentation. And those days, actually, our kids, the child protection tend to concentrate a lot of taking kids away from parents. And what happened from that time, actually, majority of them were taken to Pistoy, Collingwood. They reside there for 10 years. And looking at the trends of the crime that's happening now, those kids comes out from those areas. So considering case review, then the child protection systematic issues tend to come in, where the question of framework that you would use would also influence the outcome of your project. So we said case review need to be, it need to be considered in a way that can cover, some of the biases that if you make those reviews, you have to consider them. That's number one. Number two is about what we are seeing now, about the curtailing system that's happening in SEDAP, where that was, by the time when I was in Melbourne Uni, I was invited to ABC to talk about the profiling that was happening with the police. By then, actually, police went as far as, training police department on how to identify South Sudanese from West Africans or Kenyans. They went on by talking of, if you want to know South Sudanese that are tall, skinny, black, then the other one, there's the South Sudanese. That was racial profiling. And then it went on, it was not addressed. We went and campaigned for that. Now it reached the stage where we are seeing, I think one of the authors in America talk about curtailing system where the suburbs have to be stratified on how, they would confront other groups and say that, if you go to Western suburb, there are groups that are against you in Eastern suburb. So basically, if the kids from Eastern suburb come from Western suburb, they will be attacked immediately. It's happening now. It went as far as even families are being attacked directly in their houses. Last 2 weeks, we have one of my cousins that came from South Sudan who was attacked, and the attack was so severe, and the police actually had to inform the rest of people that, you might be attacked if you are not careful, because they have a data information that they track. So this become both systematic issue and social issue if we talk about the framework that we can try to analyze this. So my question would be around the designs need to be co-designed to have, to consider the community so that they are part and parcel of this and give an input, which I know you're doing, but it needs a lot of resources that need to be put across, to ensure that this should not happen again. Because high representation in those prisons becomes so high, in a way that, I went to Australia Health and Welfare Department prior to look at the data of Aboriginal kids that were detained in prison and the reason as to why they were detained. If you look across the data of South Sudanese, they're more or less similar. So what comes to your mind immediately is that as far as Aboriginal concern in this country, all those problems are not addressed up to now, and they have been here for ages. There's a similar trend that South Sudanese are taking. So there's a picture that you can understand, because in a population of 0.1 being overrepresented in the prison, that's quite concerning with the system. So how do we address such biases before we could even tap in talking to communities so that they're able to contribute towards this project? That's my concern. And how best do you think that the solution will be addressed if the system is not adjusted?
I've got a couple of points that I can respond to. I might start with the issue around child protection. So that has been an issue that's been raised by a number of stakeholders. So as part of the case file review, the child and families interaction with child protection services will be examined, and DFFH, Department of Families, Fairness and Housing, they have the child protection portfolio, and they will be on the interagency committee. So it's within the remit of the project to look at that data. And the same goes for Victoria Police as well. They're also on the interagency committee in terms of the issues you raised around racial profiling and training of police officers. And but in terms of the designs of the project, there will be open community forums next year for people who join the mailing list will be able to come along, and there'll also be targeted outreach through key organisations, and for example the mothers groups and Foundation House, and they'll be able to sort of triage us out to other organisations as well who are relevantly part of the community. So it's not going to be a once-off consultation. It's really going to be ongoing consultation over the next 2.5 years. And through all that ongoing consultation, that's the ability to gather all that qualitative evidence and fact-finding around what's actually happening, to then build a case around what are some of those systemic representations that need to be made across, whether it's housing, education, child protection, Victoria Police, even transport has been raised through their portfolio of ticketing officers. You know, people checking tickets on public transport is often one of the ways that it's the first interaction for young people with a law enforcement type agency. So it's going to be really that whole of system, whole of government response to the overrepresentation issue. So, Mabu, I hope that answers your questions and comments.
Yeah, that's right. Thank you for that. Yeah.
Wonderful. I think Peter's got his hand up as well.
Yeah, if I can, if you can take this question as not a grumpy one, but how many of the 300 people in remand or in prison are under 14 or 14 and under? Because there is reform to stop imprisoning people 14 and under. That's the first question. The second is, if 100 of them have been released in the last 6 or 12 months, how many of them have been guaranteed jobs somewhere?
So in terms of the age of criminal responsibility, that's that issue around the age of 14. So at the moment, the age of criminal responsibility in all the states and territories is 10. But with the new federal government and with the recent election here, there is discussion, I understand, around potential movement on that issue. But this sounds very governmenty, but that's not my team. That's kind of a different area.
My question was, how many of the 300
how many
South
of them?
Sudanese?
Not many in terms of the 300. So the numbers of people who are at that lower end is not high compared to the overall numbers in the youth justice system.
We're talking 30 or 50, or what's the?
I got the latest report today. So I'll just try to open that while I talk to you. Sorry about that. And in terms of guaranteed jobs, when they're released, that's not really information that I have at hand. So usually what happens is, as part of young people when they're, and maybe I'll actually get Cecilia to talk a bit more about it with her experience working in Parkville around the parole planning for when young people are released.
I'm giving an inferential suggestion that our existing approaches haven't been useful, and that we should give people places at TAFE or university or schools or a job if we don't want them to be recidivist and be back into the system. And so I'm a former DHHS person. We did a data linkage project where we said, okay, so what's the chance that if you were a child protection client as a 12-year-old and you're at a housing commission and you got your first criminal offence and then you got into drugs and then it was blah blah blah, you could trace the degradation, and the self-reflection was this was a failure of government sequentially, one after another. And instead we were prepared to criminalise and then imprison in poverty, in effect, and government failure. And the solution amongst the people that I would speak to would be, what would make a difference? People say, well, stable housing would make a difference. What else would make a difference? A job would make a difference. Well, why is it so hard to get a job? Well, you can't just guarantee jobs. It's like, well, we do everything else except the thing that would make the most difference. So that's a sort of little speechifying, but I am interested in how it's being addressed.
Yeah, no, absolutely, Peter. So issues around what we call them protective factors and factors around reducing rates of recidivism that include obviously securing employment, stable housing, family relationships. And so the jobs portfolio, housing, they're all on that interagency committee. So they'll all be part of trying to find the holistic solutions, because there's no silver bullet answer to the issue, depending on who you speak to, Peter, the different stakeholders. But I've got the data open now around the numbers actually in terms of under 14, and it's incredibly low. There's as at today's date, there's 6 young people who are 14 or under in custody, and in terms of under community supervision, there's less than 10. Anyone else got anything they'd like to ask Cecilia or me?
Yeah, Joseph, your work actually is amazing because you're not focusing about the behavior that's happening. You're focusing about the history, why is the children, they behave in this way. So in this case, this is the best way to just avoid the children from the future to do the same job, the same behavior. So that's why we start talking about the history. You provide them what they need, house need, whatever they need. So in this case, they stop, I think, this behavior. So I think this is the right things. Instead of focusing about the criminal they did, they're focusing about the history, why they did in this stuff. Like any doctors, you take any, procedure, what happened to you, why you end up here. You know what I mean? It's the same thing as mental health. You had to understand what the children's going through from their home.
Thanks for that comment, Wendy.
I just wanted to add something, Joseph, and I think it's a follow-up on Peter's question. It sounds like there is a transition from when the young people are released into the community into employment. But considering the age that they get into the system and the experiences that they go through, when they come out, is there any medical or sort of health transitional process before they get released into the community in terms of being assessed on the sort of mental health, for example, and their behavior, like Wendy mentioned? Is there any process in place?
No, that's a good question, Peter, and I do know the answer, but I might throw to Cecilia because she has more direct experience working in the Parkville Centre with the young people.
Yeah, there is assessment, and people, for example, they're going through violence. They have to go through training for a certain time, depend on many sessions until they provide with the certificate that their behaviors change. And in this case, they might provide him with, based on this assessment and based whatever psychologists they wrote the report about the situation. This person has been monitored for a while and see this behaviors change, and they can provide him with whatever employment or training. Yeah.
If I could just add, I think there are definitely a lot of services that are available to these young people. But I think one thing we, throughout our work, we noticed as well, there are gaps that we'll continue to try to understand and fill these gaps. But in terms of young people who are on bail conditions, for example, they tend to have more services that are available to them. And that could include mental health services, education services. But for young people who have been fully released and have no connection to IJ during the time that they're released, I think that's where the gap can occur at times.
And so that's something that we'll be looking at as part of our project, is post-release, whether it's supervised release, like if a person is released on parole, or if they're found not guilty, for example, and then they're not supervised and they're released, what are some of the pathways forward from them to help them not re-engage with the justice system?
Thank you very much. I think that's great, Joseph and Cecilia. That's a great presentation. Yeah. We are running out of time. I think we've gone beyond the scheduled time. Monica, do you want to ask any question? I saw you're chatting here. Okay, you can call me on phone. Okay, that's fine. All right.
No, I didn't mean on phone. Sorry, I didn't say on phone.
Okay, call me. Okay, that's fine. Yeah. Then now we move on to Peter to give the last remark. I think it has been a long day. 2 hours and a half, in fact. I think everyone is tired. But Peter, I think you're welcome to give a last remark on behalf of Center for Migrant Refugee Health. And before that, I would like to thank Martha for the great work today.
Question about please.
Huh?
I was going to ask something
Okay.
about the kid. That's why I said, could you call me?
Okay.
Yeah.
Then I will give you 2 minutes. Thank you. Ask the question yet.
Yeah, I have 2 questions actually that I want to. It's a question, and I just want to talk about young people, those who are in a detention center. My question about the young people in the detention center. Sorry, I just went to. My name is Monica Majak. I'm a chairperson of Mother Collusion, working with young people and the mothers. Yeah, my question is like young people who are in detention center. Their visa has been cancelled, and they don't have any access into this country because of the visa that has been cancelled. And I don't know actually, like now they're struggling. Most of them, majority of them, they're crying out. They don't have any access for treatment, like those who have dementia or those who have depression. They don't get any assist in the prison. And when it comes to coronavirus, how will they get help there in the prison? And why they're not being assisted? Because even in terms of the food, they've been crying out, they don't have any good food in prison. That's the 2 things I want to ask for those young people who are in detention center in Nyanga Hill or in Christmas Island. And lastly, when I heard about the young people in juvenile here, we have young people, those like the kid, as I put it before, like there's the kid that being taken away from the family, the parent, and they're ending up on the street. This kid, most of the young people, South Sudanese, when they're coming out, they don't have any assist. They don't get any support because I heard here, most of them, they are struggling when they're coming out from jail because they don't get any assist. They don't get job. Even though if they've been assist, they get assist, but they're ending up not going to job. So, and I don't know why those things happen to them. And we are here as a citizen, or we've been brought into this country as we take Australia as our country. If there's anything that happened, our children should be treated like other children here. But something like that is not there. So that's why I just came up with this, because most of the children, I get in touch with them. They don't have job. They're always crying out. Why the community cannot help us? And we don't have any power to help them. So if there is a program like this one, these kids should supposed to be helped. There's a lot of program I can see online that they're supposed to help children, but these children don't get help. And that's why they have a lot of crime. Thank you.
I think you can give a bit of comment, Joseph. Or?
Yeah, absolutely. Thanks, Mabel. in terms of the visa cancellation issue, that is something that has been mentioned a couple of times, well, more than a couple of times with us, Monica. So that's something that we're actively considering. The complicating factor is, of course, that's the federal government jurisdiction, not the Victorian government, but it's something that it has been raised on a number of occasions by a number of stakeholders. And the point you raised, Monica, around the children being released and the support's not working, that's something that we'll be looking at, is how, if there are services that are there, how culturally appropriate and sensitive are they, and why are they not working? That's something that we'll be examining as well as part of the project.
Thank you, Joseph, for that comment. I think we are running out of time and have really violated health and occupational safety here. We need to go, need to break, but with that, actually, I just want to quickly invite Peter to wrap it up. And thanks for the team and everyone that have come. Peter will just edit it. Thank you, Peter. Not the other Peter, but Peter Kosher.
We don't know which Peter is supposed to be talking.
Peter Kosher.
I was on mute. I was talking to myself. Sorry. Thank you, everybody. It's been a great day sharing the ideas and coming together. My name is Peter Kucher. Part of the team for the CMRH. My role within the organization is literally, finding partners or people that we can, connect with in the areas of health to the community. That's my area. Now, just to put into perspective what, for the members of the community that may be in the audience, what our position is really is acting as a channel, or a bridge between the right authorities or facilities that you may need for help in terms of health. We connect the community. Example is during the COVID, we realized at the time when the public health policy was changing almost weekly, it was almost impossible to really make sense of the information, or even accessing that information at the time, considering what was happening. And so that's where we try to fill that gap to literally help those who seek more understanding of that policy, and also bring closer the community, the Department of Health, where they need to reach the communities of our kind. So that's us in terms of the community. Now, we did a little bit of consultation with the community at the time, and the small business as well within the community. And two major things that we found, which we reached out to John, and thankfully there was a response, which Mobir has spoken a lot on before, was accessibility to the information that there was, and also how to really understand that information. And so that was one big thing. And using the platform of an organization like this, we had the opportunity to reach out to the department. And out of that, we have a seminar like this today. Thanks to the Department of Health, we were afforded some funding to further some information to the community, and also where some resources are required, such as rapid antigen testing. Resources were required. The department would channel that through the organization, and we pass that on to the community or to the community leaders that that could use them or pass them on to community gatherings that would benefit from that. Now, we just don't stop at coronavirus or mental health. There are a lot of other health problems that there are in the community, and there is no blanket rule that that apply to everything. So there might be isolated issues, but what we do here is stand before the community and say, if you have an issue that you are not sure how to or where to reach out for help, and then we could try, to direct you to the right areas of help. We don't have all the personnel that can help, but we surely can find the right channels. And to our partners, specifically the Department of Health, we understand the load of work that you guys undertake. As Mabir mentioned before, we had the opportunity of working for the Department of Health before, during the COVID response. It was an enormous task, and part of the role that we were tasked to work on was called the CCU, where we would interact with some community members directly. And there were some times where you would receive a call and someone was so overwhelmed that they almost did not know what question to ask. And you on the other side of the phone would feel helpless, or because you can't help them. You don't know what the question they're asking, except you can throw things within the scope of your area of work. And so from that, we understand that there are gaps or there are limitations to what you can do as an organization or as a department. And that's why we reach out, to yourselves, people like John, to use us as a linkage. If there is an information that you need to reach the communities that may have, a very little literacy in terms of understanding public health information, that is what we can do to help. And we really appreciate, the collaboration so far, and we look forward to further that, and if there are also other organizations that work with you or projects that are coming ahead where you need assistance, we are more than happy to participate and achieve the goal that you're looking to. So that is what I can say. And again, thank you everyone for attending this. Dr. Lake, thank you very much for taking time out of your day. We really appreciate. What this means is educating ourselves in passing on the information, because I myself, I worked for WorkSafe, And there is a lot of issues in terms of risk where the young people have been involved. And we are working on a program where we are analyzing all the programs that there are to minimize or reduce risk and injury. But we see that there's all the policies that are required are there on the system. So where's the problem, you know? It's the delivery. It's the delivery. So if we find a framework, you know, to link the culture and understanding, then, you know, the approach will be easier for someone to, you know, to develop a culture of understanding what risk is and you know, respecting it or taking the duty in terms of, you know, looking after themselves and others, you know, in a workplace. So I think it's the same thing that we're doing here. And I appreciate everybody for the participation. So thank you very much.
That was great, Peter. And I think I would just say that thank you for everyone who have just attended today, especially John, the team, the local public health unit, Catherine and Peter. You really amazed us with the great session and presentation that you have made. Otherwise, we're moving forward to next year, and I would wish you Merry Christmas and Happy New Year. And be safe, please, until we meet next year and do some work. Thank you very much.
Thank you.
Bye.
Thank you. Bye.
Thank you. Bye. Thanks.
Thank you. Bye.
Peter.
Thanks, everyone. All right.
I think it was good, yeah?
Yeah, that was